What is the issue with pre-existing conditions?
Well, President Trump is clear that pre-existing conditions are going to be covered and Americans want them covered. The question is, the issue is, how are they going to be covered? How are they going to be covered? Because 5% of Americans use 50% of the health care costs. 5% use 50%.
5%.
Use 50% of the health care.
That doesn't add up.
And that means that if we cost share, Bill, that everybody pays the same premium, those premiums are going to be sky high. If we all try to reach out and cover the 5%, that's how come Obamacare is broken. That's how come premiums are so high. The MacArthur Amendment introduces another idea. Why don't we give states the option of creating high-risk pools where those with pre-existing conditions could be covered outside the general pool, and so then the overall premium for a young person, for someone that's not sick, might be lower. Here's the catch point. Who's going to pay for that? Who's going to pay for that? The Kaiser Family Foundation has done a study on this and said high-risk pools work. They actually work, but they're underfunded. And I believe that President Trump is sending a message, and he has implied this on several occasions. Maybe more money would be sent there than before. Right now we're spending $64 billion a year to subsidize the state exchanges. What if we used half of that, $30 billion, and subsidized high-risk pools in the states that decide they want to go that way?
Would that account for coverage for pre-existing conditions?
I think it would, and it would account for America's compassion. We want to take care of our sick. The question is how. If we make a 25-year-old pay for a 60-year-old with diabetes and heart disease, they're not going to be able to afford the car they want to buy. They may not be able to afford their house.
Two questions, and you just heard what his position is in that answer on CBS. Is it okay for states to manage these pre-existing conditions?
Well, I think it is for a couple of reasons. First of all, states have traditionally been in charge of insurance markets. Since Obamacare came in, we keep talking federal government, but most of the laws applying to insurance are on a state-by-state basis. The other thing is we can create guidelines like you and I just did. Let's tell the states what to do. Here's the minimum. Everybody's got to be covered. You've got to subsidize it. Take the subsidies out of the state exchanges and put them in the high-risk pools. That would work.
Very interesting. When you examine all of this now, what do you explain to patients and the public, and I know you do a lot of writing as well, how do you define the following question? What is the role of government in insurance, in health care?
Bill, that is the key question, and nobody's talking about that enough because government has gotten too connected to the insurer. The role of government is public health. The role of government is to say, how do we keep you out of emergency rooms? How do we pay for that? How do we cover epidemics? How do we cover vaccines? Epidemics including the opioid epidemic, by the way. But when you start getting into the weeds, making sure everybody gets a colonoscopy, making sure everybody gets a mammogram. They should. Everybody should have a mammogram and a colonoscopy. But if you cost share that and mandate that everybody pays for that instead of making the government provide that care directly, it gets very expensive. And that's why the premiums are so high, and that's why there's so fewer insurers willing to cover this.